Good morning, everyone. It's very glad that I'm able to give you the tips regarding our party. Today, I'm with a party discussion, especially in the reading OET. And topic is very common. I'm sure that most of the students have practiced this fracture, dislocation, and sprain in your previous time. So again, I'm going to explain that because this is a exam based question. When you are practicing the OET, please make sure that you are using the authentic one. It's okay, sometimes you can use a different material, but I'm not saying you cannot use all those things. But when you are analyzing, when your exam is near, when you are having a bit of the tense regarding your answers and and not getting the answers, that time I'm explaining and advising you to take a decision that if it is not authentic, don't get stressed by yourself. Because yesterday I got the one comment in this the listening part that student has mentioned about the feelings and feeling. Sometimes it matters the answer in the authentic and non-authentic. So when you are choosing and practicing the not recognize these thing, material things, what you will lead you may end up with a difficult to answer, and the audio is playing different, and you need to answer in the past tense or in a plural sense. So plural tense, when you are using that, to make sure that you are practicing with the authentic one. So I'm giving you these tips before heading to the OET reading party. So party is very easy. I should tell you all, to be honest. I know it's a cup of tea for me, but I'm 100% sure that not for all the students, but I'm 100% sure as well that you can come to my level and more than that in the future during your exam time if you are using the tips that I'm going to explain today, as well as with your knowledge and with your betterment and getting the good shape from the many of the coaching and your practice. You will come to that level. Okay, so practice in the OET. So first thing is fracture, dislocation, and sprain. This is a very common reading passage for me and for everyone. So this is exam based question. When you are getting the question paper, right, when you are getting in the exam, this just predict yourself, this is the question, this is a text you are getting in the exam. First thing, you need to take a long breath. After that, what you need to find is what is a text A, what is a text B, what is a text C, what is a text D. That you need to analyze within the 2 minutes. Okay, within the 2 minutes, I'm telling you, not more than that. How you will analyze this? You should read fractures, dislocation, sprain. That means these three are the types of fractures. It's related to these things. So they are going to explain the meaning, definition of these three things. So I should not be worried in a text A. What is a text B? Text B is a combine of three things. See here, immediate management, instant management, that is required during the fractures time. And also assessment. Assessment means, in a paraphrase, we will see the symptoms and what are the conditions we can observe, we can see at the moment, clinical observant. And then what is the third thing? Management. That is a general management. There are two management, immediate and the management, that you should keep in your mind. Now text B is over, and text C, easily you can identify this is related to the drug therapy, no need to worry at all. And now text D is related to the technique of putting the plaster for the arm fractures, not a limb fracture. Okay, and use the same principle for the leg fractures. So this is a technique. Now this within 2 minutes you will take less than that as well. In my case, I'm using less than that most of the time, because I don't waste on the passage, getting the passage. Once after that, you should go to the question part. So question part, in my case, I will not go with the 1 to 7. Why is that? Because if I know the passage very well, after getting all those 8 to 20 answer, this I can get with the maximum of 7 out of 7 or 6 out of 7 I will get. and so this is not a big deal, right? So I won't waste the time here. Sometimes they keep some tricky things, so you may end up losing the more of the times here, but not for all the students. I'm telling you to change your pattern. Okay, no need to change the pattern, and just go with your pattern as well, but try to take the tips which I'm going to tell today, because in a part A you need to be very tricky, and you need to tackle the situation without tense. When you are tense, you are wasting the time. When you are more tense, the more answer you are not getting, the more you are tense. If you are tense, you are losing more of the time. So time is very precious in the part A. So 1 to 7 I will go at the last in my case. So first thing 8, how I will answer is, first thing is I will go with the keyword. What should be used to elevate the patient's leg fracture? What are the items going to use for the leg fracture? We have seen in the part B, right? Part B, I have seen already that it's an arm. It's a fracture arm related and management. Okay, part B. So text B I'm talking about. So I will go directly to the text B. What things we can use? Immediate management, nothing they are talking about. Limb and leg is paraphrase. Okay, I got the answer. We are not talking about the assessment. I'm talking about these things, management. Elevate limb, they have talked about the elevating the limb in the leg, right? Limb. Okay, up below is there. So your answer should be what? You get the idea, right? This is a way to go the answer fast. You need to write the answer fast as well. Up pillow. Some student will tell, do I need to write up pillow or pillow? It's okay if you are missing the is not a wrong answer. Okay, you will get the marks as well, but not in all the case. Sometimes there will be the plural thing, that time you need to mention, that time your answer will be wrong. But now it's okay if you mention the or not without that doesn't matter in this case. Okay, so now next, what is the maximum dose of morphine? It's clearly easy, right? You have seen the passage. Text A is talking about definition, text B is management, immediate and general one, and the observer of the symptoms, and text C is related to the dosage of the medicine. So it's related to the medicine, so you can jump directly to the part C without wasting your time. So part C, okay, morphine maximum per kg dosage. Okay, per kg maximum 0.1 is the least and 0.2. so your answer should be 0.2 mg, because dosage, if they are talking about the mg means no need to write in the answer mg, but since they have mentioned only the dosage, your answer should be 0.2 mg. Okay, but in many students they will answer either 0.1 with a hesitant, or if they are so happy with the maximum. This is a distractor, be careful with that one, student, and this is a distractor. So this is kg to a maximum of 10 mg. If the kg, how much it will be, the maximum only should be the 10 mg, but they are not talking, this is not per kg. Okay, not per kg, it's a kg, how much the student is, kg 40 50, based on that the 10 mg is the last dosage that they are talking about, not the per kg. The question is about the per kg, so you should match the question as well as here the answer. So you will get 0.2 in my case. I don't know answer is right or not, we'll check at the last. So 0.2 mg, right? So be careful with the capital and these all things. Okay, it is going to take the marks. 0.2 mg. And now third things, which part of limb may need the extra padding? Again, extra padding, where is that? We have seen in two sections, right? But either part text B is talking about management, or either text D is a technique. So these two things you should go. In my case, I will go with these two. I don't go with the part A, text A, or text C. I will not waste, so I will jump like this. Okay, extra padding, I can see extra padding here, right? Extra padding. In my case, always whenever I'm searching the answer, I always go with this keyword, extra padding. I can see in the last things as well, so I will go to the next this thing. Okay, where is the extra padding? Okay, I cannot see. Okay, answer, I always go with the last and this. Okay, beginning and the last of the sentence. Okay, extra padding. I've clearly seen here extra padding. Then I will read extra padding can be placed over the bony prominences. So you can write if applicable. So you can write what? Extra padding in the bony prominences. Clearly you can write this answer. Prominences, bony prominences, which part of the limb may need the extra part. So they are talking about the bony prominences. This is the way to tackle. Okay, and I will show you the other thing as well. This thing, what should be used to number 11, what should be used to treat a patient who suffered the respiratory depression. If the patient is suffering about the respiratory depression, what are the treatment? So we have seen the medicine, right? So here, okay, I cannot see here. This is not possible. Respiratory depression is rare. If occur, it give naloxone. So answer is naloxone. This is a way to tackle. So now I will give. I don't want to take more time in your this one, because if I take more time, you may get bored. So I will tell you my tips. My tips is regarding C. The answer will be dislocation in the question section. So dislocation is the initial part, right? So C, elbow dislocation after falling outstretched hand. This is sometimes how you should go is your answer may be in the beginning, and sometimes you may not get the answer. The keyword will be at the end or in the beginning. I will show you as well. See, the answer is in sometimes only it will be in the middle. But when you are hesitant, you are not getting answer, don't lose the hope. Just go. If you are not getting the 9 answer, okay, just go with the 10. If you are not getting 10, okay, go with the 11. And then still you are not getting answer, go with the 18, 19, 20. Most of the time 18, 19, 20 will be the easy answer. So you will get the chance to relieve yourself from the stressing. So you will get the answer. Okay, so most of the answer will be see clearly here. Compartment syndrome, right? Is the beginning, fentanyl is in the last, is a pillow in the last of the sentence. Either it will be in the between or it will be in the beginning of the sentence. Here last, so you can see stocking. This is a middle sometimes. Okay, either you can see the ensure jewelry, right? This answer in the beginning, crab bandage. Sometimes what you extra padding, right? This sentence the same, you are getting the extra padding means you will get tense. Where is that? Don't go with the extra padding only. Sometimes the answer will be in the beginning, or sometimes the extra padding will be in the beginning only. So go in that way. That is a way to tackle in the part A. And now in this one paragraph, how to know this paragraph. So I will tell you. Okay, procedure of delivering the pain relief. Where is that? Relieving the pain, we clearly have seen that it's a part C, right? Part C, we have seen the medicine to relieve the pain, and the procedure to follow when spleen fracture limb, it is a text D, right? Procedure, technique. And what to record when assessing the patient, we have assessment in the part B, right? It's clearly. So term used to describe different type of fractures, A, right? We have seen that. So this I'm not writing. I don't want to waste my time here. It's okay. And the practitioner medicine who administer the analgesia is in the part C, right? Medicine. What to look for? What to look for when checking the injury? It's a B, right? And how fracture can be caused? It's in A. So we'll see CDB. I don't know, CDB, okay, right? ACBA. ACBA. Okay, I got all the answer. So this is a way if we are knowing where the procedures is a medicine, the procedure to deliver the pain is a medicine, right? Delivering the pain, the procedure, you may get doubt again, this procedure to fracture the limb is a technique, and assessing, it's a assessment. We have seen the term use, I told you definition, a practitioner who administer analgesia, it's a medicine part. And what to look for checking the injury is again B, assessment. What to look, checking, assessment, how fracture can be caused. A, they are explaining about the different type of the fractures. This is a way to tackle the part A. Part A is very easy, and I will give you the more tips in detail if I have the more time and this thing for today. And hope I have cleared all your doubts, and this is a way. And one thing, okay, in a part A, when you are getting the question, okay, what should be used to elevate a patient fractured leg, and if it is this kind of, if they are mentioned upper limb fracture should be elevated by a means of means is there, means don't write again okay. If you are writing again, then you are losing the marks. Falling outstretched hand is a typical cause of a, what is that, of a dislocation, right? We have seen in this. See, I told you before, right? Falling out on the outstretched hand, dislocation. This is a way, falling outstretched, dislocation. So you should not write again, okay? And like this kind of. And when in here, what are the dosage is there? If the maximum dose, like a maximum dose of morphine per kilo is not mentioned, means you need to write here per kg. Okay, if it is not mentioned. If it is mentioned, no need to worry, but if it is not mentioned, you need to write. And sometimes what is already mentioned, which part of a limb may need extra padding, so bony prominences, that time no need to worry. But some question is already listed here, in that no need to write again here, you will lose a marks. Okay, so that much for reading part A, and I hope I have cleared all your doubts. And then thank you so much for giving me the suggestion to make a party for a very long time, but I'm very sorry for taking so long time as well. And thank you so much for viewing my videos, and I wish I can help you more with the more videos. And that much for party. And part A, just don't worry, just get relaxed. If you are not getting on the 8, 9, 10, just go with the 18, 19, 20. In a part A, you need to be relaxed. Try to relax yourself and don't get stressed anytime you are getting. Part A is judging about the stress level, how you are managing critical thinking. That thing is being judged in the part A, in my view. So I like to suggest all my viewers to take a decision of being relaxed when you are reading the part A, and when you are doing that, don't try to go that someone is able to finish with the 8 minutes, I will do that, but try to achieve a best or the right answer, so that you will get the good score. If you are able to manage that, you will get the high score in the exam. So part A is really playing a major role. If you get 20 or 19, you will pass for the sure. Thank you so much.